Hi, everybody. I'm Dr. Adam Mathews with Mathews Counseling, and all this month, May, is Mental Health Awareness Month. So, we have just been bringing resources around certain topics to raise awareness about mental health. And one of the things that we want to talk about a little bit more is mental health and ADHD, attention deficit hyperactivity disorder, which we are learning a lot about over the last 10 to 20 years. We've learned a lot more about how divergence in general, but ADHD and specifically affects people and their mental health. And we want to just chat about that. And here to chat with me is Ashley Kingston. She's a licensed clinical social work associate with our practice. And she sees people with ADHD as kind of just to help as they're learning about how that affects them and how better ways and tips and tools to help with that. So Ashley, first off, hi, how are you?
Hi.
And so let's just start off by talking about exactly what are we talking about when we're talking about ADHD. Can you help us, just anybody that doesn't really know? It's one of those terms and that is just out there in pop culture and in the world. And sometimes we understand it, but sometimes we don't. So help us get to what's a good understanding that we can come to around what exactly we're talking about when we talk about ADHD.
Sure, absolutely. So ADHD basically is a neuro imbalance, right, between all the chemicals in our brain, and we can go further into that if we need to. But I think a lot of times people think ADHD looks one way, so we might have an idea of little kids bouncing off the walls and not sitting in their
Yeah.
seats. And one of the main things that I work with clients on is that they might have an ADHD diagnosis that doesn't look exactly like that, but they still have those main pieces of ADHD, right? Like inability to focus, lack of concentration, feeling overwhelmed by maybe minor tasks. They don't feel so minor to people with ADHD. And then that hyperactivity and impulsivity piece of it as well. That is a big catch-all term for a lot of different behaviors. And if we look at the DSM diagnostic criteria, we can get a little bit better idea of what that actually looks
Yeah.
like.
Yeah. And there is DSM criteria to be able to meet the qualifications for ADHD. And so I do want to mention, like, one thing that we talked about briefly beforehand was this idea of people sometimes say, "Oh, I have ADHD," and they don't actually meet the qualifications for it, or they haven't been tested. Can you talk a little bit about why it's important to be tested to confirm this diagnosis before you move forward trying to work with it to try to get help
Sure.
with it? Yeah.
Yeah, absolutely. I think with any sort of mental health diagnosis, it's important to get a strong assessment to rule out this is a depression symptom that might look like an ADHD symptom, or maybe I'm experiencing anxiety because of my ADHD. But what an assessment can do is really give you a clear idea of what exactly it is that you're working
Yes.
with. And that can help when you're working with a therapist because they can get to the root of the problem with you a little bit. If we're thinking that, okay, we're having some depressive symptoms, and the root of that is depression, great. That's a very clear
Yeah.
way to go. But when ADHD starts to come into play, or anxiety, or any of these other sort of mental health diagnoses, it can get a little bit gray area and harder to really nail down what's going to be most helpful for a client.
Yeah, because I think it's really hard sometimes, because sometimes we go, "Oh, I have these qualities. I may be a little more, my
Mhm.
personality may lean a little more toward impulsive, or I may be having trouble focusing." And if I try to self-diagnose that, I could possibly be working on the wrong thing. And
Right.
so getting some help and figuring that out can be really important. When you have a client come that does have a diagnosis of ADD or ADHD, what are some of the common things that you're trying to help them accomplish? What are some of the common things, that the symptoms that they're coming in with, and you're saying, like, this is what I'm helping them kind of work on to achieve?
Sure. I think that it looks different for the kids and adults that I see. Kiddos, I'm working a lot with parents to manage behavior in a classroom, which might look different than what we're picturing as ADHD. But some kids can't focus during a 3 hour period of school, which is silly to expect them to do. So, anyways, with younger kids, it's a lot of skill building. And then with adults, it's a lot of skill building. It just looks a little bit different. So, people come in a lot of times not being able to get their work done. Procrastination is a huge piece that I see because people with ADHD can get overwhelmed by tasks very easily,
Yeah.
and they need to come up with certain ways and structures to break those things down into more manageable pieces. That's a big one
Yeah.
that we've been working on a lot.
Yeah, because I think and you talk a lot in the blog post that you wrote about the myths of ADHD, right? And you're hitting on the need for structure, the need for tools to help move past some procrastination, to move past the lack of focus, right? Things like that. But I think it's important to talk about that is doable, and that doesn't, especially in the language of being neurodivergent, that it means that you're just wired differently and you need some things. It's not a deficit as we tend to, as it can be in the title a lot of times, right? That title doesn't really capture it, because we're not talking about something that's a deficit. We're just talking about a different way that you are wired, and you might need a little extra help, but outside of the traditional ways that are given to people that don't have ADHD. So talk a little bit about some of those myths that kind of still persist, even though ADHD has been in the culture, it's been in the conversation for a really long time now. But what are some of the myths that you see that are still persisting?
Yeah, I think the biggest myth that I see is that ADHD can just be used as a label to throw on someone as a lack of discipline, or they're lazy.
Yeah.
But like you said, their brain just works differently than people who don't have ADHD. So our society is also built around people who are neurotypical. And so people who do have ADHD or other sort of neurodisorders, they operate on a different level, or a traditional school might not be the best option. There's so many different things that go into that, but I think a lot of the times people can internalize that and think that something's wrong with them. And a lot of what we do in therapy together is normalizing a lot of that and making sure that they know it's not something's wrong with them. They're just working a little bit differently and figuring out ways to do that.
That's exactly right. And I think it goes also to this idea of understanding what we're talking about. Because if I just think it's laziness, or if I think is like ADHD is just covering up this lazy personality that I have, or lazy impulses, or lack of discipline, then I'm going to be working on a lot of the wrong things, because I'm going to be trying to, like, what we call strong arming this thing that's just not going to work, because I'm using the wrong structures to be able to accomplish something that other people need different structures for. And I think that's really breaking that down. Then we're actually working on the right thing. We're going, okay, I'm not lazy, and so I can't just try to strong arm or strong will this thing that's going to happen, right? Because it can be that pattern can be really self-defeating. Do you see that a lot? That self-defeating feeling that comes up a lot for people that have ADHD?
Definitely. I see it mostly in my adults who maybe have gone their whole life with ADHD but have not had a diagnosis.
Yes.
So there's a lot of misconceptions, and parents who are trying to work with a child like this, if they don't have the right education or the right resources, they might not know how impactful it can be to say those kinds of things to your children, or to even talk about other people that way. And so it's a lot of unwiring of that default of, oh, I can't go clean my kitchen because I don't have the willpower, or I'm lazy. Okay, no, maybe we're a little overwhelmed and we just need to break it down.
That's right. Yeah, so dispelling that myth that there's something wrong with us. If I am someone that has a ADHD diagnosis, then breaking that apart, even for myself, is really important. And then if I know somebody, understanding that it's not just something that they can all of a sudden just overcome with more effort, or that it's not located in them, and not reinforcing that myth. That's really good. Exactly. What's another one?
Another myth is that ADHD is only present in childhood, right? With ADHD becoming a little bit more researched, or a lot more research recently, we know that's not the case, but a lot of people who aren't in the mental health space don't really understand that. And a lot of people also have the belief that if ADHD is not diagnosed in childhood, they must not have it.
That they've grown out of it or something. Yeah.
Yes, exactly. But really, they might not have grown out of it. They might have put different skills and structures into place to cope with it. But sometimes you get to a certain point and those structures don't work the same way anymore. And again, that means that doesn't mean that anything's wrong. It just means that we're coming at it the wrong way.
That's right. And you only know what you know, right? I think we talk about this a lot with almost any client that we see, but you only know as much as you. So if you've never been given language, if you've never been given alternate structures, if you've never had these other ideas that have come into play, or just simply have gone undiagnosed, like, you don't have the language or the tools to be able to fully overcome maybe some of the challenges that get presented. But you're exactly right. I love what you said there too, that sometimes those things that we put into place work. We may have figured out something temporarily, but at some point those things have stopped working, or in adulthood, or they just don't work in the same way. They're not as efficient for us as we want them to be.
Right.
And figuring that out. But it can be helpful to get out of that, to understand, oh no, this affects anybody across the age spectrum at any point in time. And it can present differently in childhood than it does in adulthood as well. Awesome. Myth number 3.
Last myth is that people with ADHD are unintelligent. I think that also falls into the misunderstanding around the language that we use. But people with ADHD have a very unique set of strengths and capabilities. And I think that the more we normalize people talking about it, the more that we can really see and put to use those strengths and capabilities in the clients that we see.
Yeah, I absolutely agree with that. And I think a lot of times our culture has labeled productivity the same as intelligence, right? And have made that connection. And so when we see somebody that maybe has struggles being productive or struggles focusing, we tend to label that as unintelligent. And that is just not correct. It's not true. It's not accurate. And it's really harmful to folks, because when you get into those kind of, again, those self-defeating labels of unintelligent, lazy, whatever it is, like, it really hampers individuals from being able to move forward. So let's talk about some things. What do you want? What are some things that, when we're breaking down those myths, that somebody that has ADHD can really start to move forward by engaging, right? What are the things that you really want to be able to do for them?
I think the biggest thing is educating yourself on ADHD. The more information that you can take in, the more that you can even talk to other people with ADHD, the more you'll become comfortable with the fact that, oh, wait, people are right. This isn't something that's a real deficit. This is just a different set of capabilities that I have.
Yeah, I think education is so key, because a lot of times too, understanding how your ADHD presents itself is super important. And sometimes there's great stuff out there. I think social media can be harmful, but it's also a really good resource, because there's lots of people out there saying, hey, no, this is actually a symptom of, we thought it was a symptom of this, but it's actually a symptom of ADHD. Then, like, figuring that out, looking at any kind of research you can get your hands on, reading more about it really helps you understand, oh, no, this thing that I thought was just laziness, or this thing that I thought was just a deficit on my part, is actually a symptom of ADHD, and it presents itself differently for everybody. So education is super key. Love that.
Yeah.
What's number
Absolutely.
2?
I think the second thing, this is just something that could be applicable to anyone who might not have a diagnosis right now, but still needs a little bit of support. Adding structure and organization into your day-to-day routine, whatever that looks like. I think it's also important to note that you might try one thing and it's not going to work. It does take a lot of trial and error to figure out what specific systems are going to work best for you. Me figuring out how to send 18 emails might look different than the way that you're going to do it, right? Just because we have different brains and we operate on different levels. I think that's a really important piece, is don't be super discouraged if the first thing you do doesn't work. Try something else.
No, I think that was the only thing I was going to add. And so I just want to emphasize that is everybody is different. And so structures that work for you may not work for me. And so we do have to keep trying. Oh, the other thing that I thought about while you were talking too is that those structures could change over time. Just like your symptomatology may change from childhood to adulthood. They may change over time. So you may need different structures at different points, but trying those and figuring out what works. And I want to be clear too, Ashley, too, because I don't think we're talking about huge structure. Like, we're not talking about 3-minute plan of your day or anything like that. We're talking about just a minimal scaffolding of structure that can work for you to get you moving in some directions that you want to go, depending on what you're needing to accomplish. That's really good.
Absolutely.
Okay, last thing. I think you had 3 on the blog, so give me the last one.
Yeah. So last thing, support networks, peer groups, getting support through any of those ways is great. I also think that meeting with a therapist can never be a bad thing, right? So if you can sit down and talk with someone who can kind of support you in all these things, normalizing, educating, also someone to sit down with and reflect on the week. Like you said, it doesn't need to be this giant change of structure, but having someone who knows how to ask you the right questions of, okay, when you were doing this, this was going on, and this is what was working, and this is what wasn't, that can be super beneficial for people.
Yeah, I think therapy is really good because it can help spotlight some blind spots that you have, or you may not have connected ADHD to this thing that you're struggling with. And so being able to connect them, have somebody that can help you make those connections and help you think through resources can be really helpful. And I love the idea of peer groups, because, like, support groups, there's tons out there. They're easy to find. There's an easy Google to just figure out how to get connected with other people that may share some similar struggles that you have, may have but they also will all have resources that they've tried that may work for you, that may be helpful to moving forward with what you're hoping to accomplish as well. I love that. Last thing, always ask, what's the one takeaway you want people to take away from this conversation? If they don't hear anything else, what do you want them to take away?
I hope that people know, if they do think that they have ADHD or they have a diagnosis of ADHD, that it is not an end all be all, right? You will be able to figure out what works for you. It just takes a little bit of trial and error. And I think also that rewiring of, it's not a problem with you, it's not a deficit.
Yeah. Love that. I love that. If you need help, we have therapists that can work with you that understand ADHD. Ashley is one of those, but we have others as well. And you can request an appointment at mathewscounseling.net. And we just encourage you to get help, get support. Don't just sit there and try to figure it out for yourself, because it can be very self-defeating, very frustrating. So Ashley, thank you so much for this conversation. I really appreciate it.
Thank you, Adam.
All right. Bye, everybody.